As we grow older, our chances of developing cancer don't just rise, they accelerate. In fact, nearly 70% of all new cancer cases are found in people over the age of 60. And with the average diagnosis happening at age 66, this isn't just a medical statistic, it's a wake-up call for anyone entering their later years. Aging opens the door to cancer not because of age alone, but because of everything the body has been through: decades of environmental exposure, cellular wear and tear, and a weakening immune system. Layer chronic conditions like diabetes or cardiovascular disease on top of that, and cancer becomes even more difficult to detect, manage, and treat in older adults. But here's the truth: the earlier you spot it, the better your odds. The challenge is that cancer doesn't always look the same in seniors. It hides behind symptoms that can be mistaken for normal aging. That's why it's more important than ever to understand what to look for and when to act. And thanks to advances in modern medicine, treatment today is no longer one-size-fits-all. Doctors now tailor care plans to match your physical condition, lifestyle, and personal wishes, so you're not just living longer, but living well. In this video, we'll reveal the cancers most likely to affect older adults, the subtle signs you might be missing, and the steps you can take to catch them early, before they catch you off guard. 1. Skin cancer. Skin cancer represents the most common malignancy in elderly populations, reflecting a lifetime of sun exposure and accumulated DNA damage. By age 65, many individuals have received substantial ultraviolet radiation exposure, often from eras when sun protection awareness was limited. This cumulative exposure explains why skin cancer incidence increases dramatically with age. The three main types of skin cancer affect elderly individuals at different rates and with varying levels of concern. Basal cell carcinoma, BCC, occurs most frequently, typically developing on sun-exposed areas like the face and neck. Squamous cell carcinoma, SCC, represents the second most common type, also appearing predominantly on sun-damaged skin. Melanoma, while less common, poses the greatest danger due to its potential for rapid spread. For seniors, skin cancer risk factors extend beyond sun exposure. Age-related thinning of the skin provides less natural protection against UV damage. Declining immune function reduces the body's ability to identify and eliminate abnormal skin cells. Certain medications common in elderly populations can increase sun sensitivity, further elevating risk. Recognizing skin cancer signs is vital for older adults. The ABCDE rule helps spot melanoma: asymmetry, irregular borders, varied color, diameter over 6 mm, and evolution of a mole. See a dermatologist if these appear. For basal and squamous cell cancers, look for non-healing sores, pearly bumps, or crusty lesions, especially on sun-exposed skin. Don't ignore itching or bleeding. Seek medical advice. Regular skin checks are important with age. Since some seniors may struggle with self-checks due to mobility or vision issues, caregivers and doctors should help ensure routine screenings. Skin cancer diagnosis in the elderly begins with a visual exam, often followed by a biopsy. Doctors consider age-related factors like healing and other health conditions when choosing biopsy methods. Treatment options have expanded. Surgical removal, especially Mohs surgery, is effective for most non-melanoma cancers. For those unable to have surgery, alternatives include topical therapies, radiation, photodynamic therapy, and cryotherapy. Treatment choice depends on cancer type, location, overall health, and ability to manage recovery. Prevention remains important. Seniors should use sunscreen, wear protective clothing, avoid peak sun, and may benefit from vitamin B3, nicotinamide, to reduce new skin cancers. 2. Colorectal cancer. Colorectal cancer ranks among the most common malignancies affecting elderly populations worldwide, with incidence rates rising steadily after age 50. By age 70, the risk increases significantly, making this cancer a major health concern for seniors. The disease develops in the colon or rectum, usually beginning as a small benign polyp that can transform into cancer over time. The aging process creates multiple vulnerabilities in the colorectal tract that contribute to cancer risk. Decades of exposure to dietary carcinogens, accumulated damage from inflammatory processes, and age-related changes in the intestinal microbiome all play roles in cancer development. Additionally, the protective mechanisms that repair DNA damage and eliminate abnormal cells become less efficient with advancing age. Recognizing colorectal cancer symptoms can lead to earlier diagnosis and better outcomes for elderly patients. Changes in bowel habits, including persistent diarrhea, constipation, or narrowing of stools, represent important warning signs. These changes, when lasting more than a few weeks, warrant medical evaluation rather than self-treatment with over-the-counter remedies. Rectal bleeding or blood in the stool, even if intermittent or minimal, should never be dismissed as merely hemorrhoids in elderly individuals. While hemorrhoids commonly cause bleeding, this symptom requires proper medical assessment to rule out cancer. Dark, tarry stools may indicate bleeding from higher in the digestive tract and also deserve prompt attention. Abdominal discomfort, such as frequent gas pain, bloating, or cramps, can signal colorectal cancer in seniors. Unexplained weight loss, fatigue, or a feeling that the bowel doesn't empty completely after a bowel movement represent other potential symptoms. Some elderly patients experience a sensation of abdominal fullness even after not eating for hours. Colorectal cancer diagnosis typically includes a colonoscopy with biopsy and imaging like CT scans to assess cancer spread. In elderly patients, doctors consider other health conditions and functional status before proceeding. Treatment has adapted to seniors' needs. Surgery is key for localized disease, often using minimally invasive techniques to aid recovery. Advanced cases may involve chemotherapy with dose adjustments and targeted therapies aiming for effective cancer control with minimal side effects. Quality of life and functional preservation are central in treatment planning. 3. Prostate cancer. Prostate cancer represents one of the most common malignancies affecting elderly men, with more than 50% of all cases diagnosed in men aged 75 or older. This statistic highlights the strong association between aging and prostate cancer risk. The prostate gland, which produces seminal fluid that nourishes and transports sperm, becomes increasingly vulnerable to cancerous changes as men age. The relationship between aging and prostate cancer involves complex biological mechanisms. Accumulated genetic mutations, hormonal changes, and inflammatory processes that occur over decades all contribute to increased risk. By age 80, autopsy studies suggest that the majority of men have some cancerous cells in their prostate, though many of these never progress to clinically significant disease. Unlike many other cancers, early-stage prostate cancer rarely causes noticeable symptoms. Most cases are now discovered through prostate-specific antigen, PSA, blood testing before symptoms develop. This screening approach has significantly changed the landscape of prostate cancer diagnosis, particularly for elderly men who previously might have remained undiagnosed. When symptoms do occur, they typically result from the enlarging tumor pressing on the urethra or nearby structures. Frequent urination, especially at night, may signal prostate problems in elderly men. difficulty starting or holding back urination, weak or interrupted urine flow, and burning sensations during urination represent other urinary symptoms that warrant medical evaluation. Some elderly men with advanced prostate cancer experience blood in their urine or semen. Painful ejaculation or general discomfort in the pelvic region, lower back, or upper thighs may also occur as the disease progresses. Erectile dysfunction, while having many potential causes in elderly men, sometimes results from prostate cancer affecting surrounding nerves. Diagnosis starts with a PSA test and digital rectal exam. If results are abnormal, imaging like MRI and a targeted biopsy follow. These steps improve accuracy and reduce risks for older patients. For elderly men with low-risk prostate cancer, active surveillance with regular monitoring is often preferred over immediate treatment to preserve quality of life. If treatment is needed, options include surgery, often with robotic assistance, radiation therapy, external or internal, and hormone therapy for advanced cases. Newer drugs also help manage metastatic disease while maintaining life quality. 4. Breast cancer. As women grow older, their risk of developing breast cancer increases sharply, turning it into a major health issue for those in their senior years. In fact, research shows that women aged 65 and above are 1.7 times more likely to develop breast cancer than those between 45 and 64, and an astonishing 10 times more likely than women under 45. These statistics highlight just how vital it is for women to remain vigilant about breast health well into later life. Several biological processes help explain why age is such a strong risk factor for breast cancer. Over the years, long-term exposure to estrogen, damage to DNA from environmental sources, and structural changes in breast tissue all heighten vulnerability. On top of that, the aging immune system becomes less efficient at detecting and destroying abnormal cells, making it easier for cancer to take hold. For older women, paying attention to early warning signs can significantly improve the chances of a positive outcome. The most common red flag is a newly detected lump in the breast or underarm. While not every lump turns out to be cancerous, any new mass should be examined by a healthcare provider, even if the woman is no longer undergoing regular mammograms. Changes in the look or feel of the breast can also be telling signs. Swelling, skin dimpling or puckering, and redness are all cause for concern. Some women report that the affected area feels like an orange peel, what doctors refer to as peau d'orange. These visual and textural changes should never be brushed off as a normal part of aging. Alterations in the nipple area are another critical warning signal. These can include the nipple turning inward, unexpected discharge, crusting, or scaling. Though pain is not the most common symptom, discomfort in the nipple or breast can also point to something serious. Any ongoing breast changes, especially in elderly women, deserve prompt medical attention. When it comes to breast cancer screening in older adults, expert opinions vary. While mammograms have clearly been proven to save lives, their value shifts as a woman ages. For women in good overall health, most guidelines recommend continuing screenings until around age 75. Beyond that point, decisions should be personalized, taking into account life expectancy and individual preferences. Diagnosing breast cancer in seniors follows the same basic steps as in younger women. It starts with a physical exam and imaging tests, followed by a biopsy to confirm the diagnosis. Imaging also helps determine whether the cancer has spread, which is crucial for choosing the right treatment path. Options may include removing just the tumor through a lumpectomy or performing a full mastectomy, with the possibility of breast reconstruction. In older patients, the emphasis often shifts toward balancing effective treatment with quality of life. Many elderly women diagnosed with breast cancer have tumors that are estrogen receptor positive, which means the cancer cells grow in response to estrogen. For these cases, hormone-blocking therapies like tamoxifen or aromatase inhibitors are often effective and generally easier to tolerate than traditional chemotherapy. 5. Pancreatic cancer. Pancreatic cancer represents one of the most challenging malignancies affecting the elderly population, with most cases diagnosed in adults aged 65 or older. This cancer begins in the pancreas, a vital organ that produces digestive enzymes and hormones like insulin that regulate blood sugar. The disease's tendency to remain silent until reaching advanced stages makes it particularly dangerous for seniors. The relationship between aging and pancreatic cancer risk involves multiple factors. Decades of exposure to carcinogens, accumulated genetic mutations, and age-related changes in pancreatic tissue all contribute to increased vulnerability. Additionally, conditions more common in seniors, such as long-standing diabetes, chronic pancreatitis, and obesity, further elevate risk in this population. Detecting pancreatic cancer early presents significant challenges, as symptoms typically don't appear until the disease has progressed. When symptoms do emerge, they're often vague and easily attributed to other conditions common in the elderly. This diagnostic challenge explains why pancreatic cancer is frequently discovered at advanced stages when treatment options become more limited. One potential early warning sign is sudden onset diabetes in elderly individuals with no previous history of the condition. When diabetes appears unexpectedly in seniors, especially when accompanied by weight loss despite normal or decreased appetite, healthcare providers should consider pancreatic cancer screening. This connection exists because growing tumors can impair the pancreas's ability to produce insulin properly. Jaundice, yellowing of the skin and eyes, represents another critical warning sign that should never be ignored in elderly patients. This symptom occurs when a pancreatic tumor blocks the bile duct, preventing bile from reaching the intestines. The resulting buildup of bilirubin in the bloodstream causes the characteristic yellow discoloration of tissues. Other symptoms that may signal pancreatic cancer include unexplained weight loss, loss of appetite, and changes in taste or smell. Pale or clay-colored stools can result from bile duct obstruction, while dark tarry stools may indicate bleeding in the digestive tract. Persistent upper abdominal pain that radiates to the back is another concerning symptom in elderly individuals. Some pancreatic cancer patients experience unusual symptoms like itchy hands and feet, which stem from bile salt accumulation in tissues. Fatigue, depression, and blood clots may also occur as the disease progresses. For elderly patients especially, these symptoms can be mistakenly attributed to aging rather than investigated as potential cancer signs. Diagnosis often starts with imaging like CT, MRI, or endoscopic ultrasound to detect pancreatic masses and assess spread. A biopsy confirms the diagnosis, though it's difficult due to the pancreas's deep location. Treatment for elderly patients must weigh benefits against risks and quality of life. Surgery is potentially curative, but may not suit frail or advanced stage patients. Improved techniques have made surgery safer for some seniors. For those who can't have surgery, care focuses on survival and comfort. Chemotherapy is now better tailored to older adults, and radiation, sometimes with chemo, can help manage symptoms and slow the disease. 6. Lung cancer. Lung cancer ranks among the most widespread and lethal cancers impacting older adults around the globe. In fact, over 80% of all lung cancer cases occur in individuals aged 60 and above, firmly establishing it as a disease that primarily affects the elderly. This staggering figure highlights just how critical it is for both seniors and their healthcare providers to stay informed and vigilant. The reasons behind this high rate in older populations are varied, but smoking history stands out as the most influential factor. Many seniors today grew up during a time when smoking was socially accepted and its health consequences were not fully understood. Years, even decades, of inhaling tobacco smoke can gradually inflict serious damage on lung tissue, eventually paving the way for cancer. And for those who have never smoked, the risks don't disappear. Long-term exposure to secondhand smoke, radon gas, asbestos, air pollution, and other environmental toxins can build up over time and still trigger cancer later in life. Combined with the natural decline of lung resilience as we age, these exposures create the perfect storm for cancer to take root. Early on, lung cancer can be deceptive. The signs may be mild or easy to ignore. But as the disease progresses, the symptoms grow harder to miss. One of the first red flags is a chronic cough that changes or becomes more intense. Seniors who currently smoke, or who used to, should especially pay attention to this symptom. Pain in the chest that worsens when laughing, coughing, or breathing deeply should also be taken seriously and never dismissed as a normal part of aging. One of the most concerning indicators is coughing up blood, known medically as hemoptysis. Even a small amount in the sputum warrants an urgent medical check. Shortness of breath with little physical activity, if it's new or worsening, can also point to lung cancer, not just age-related fatigue. Recurring respiratory infections, like bronchitis or pneumonia, that don't respond to treatment or keep coming back could be masking something deeper. Many seniors might assume that ongoing fatigue, appetite loss, or unexplained weight loss are simply signs of getting older, but these may actually be systemic symptoms of cancer developing within the lungs. Other red flags, especially as the disease advances, include voice changes like hoarseness, swelling in the face, or new pain in the shoulder or arm. These could mean the tumor is pressing against nearby structures. The good news is that catching lung cancer early, even in seniors, can dramatically improve outcomes. That's why low-dose CT scans are now the go-to screening method for those at high risk, detecting tumors earlier than traditional chest X-rays. Diagnosing lung cancer typically involves both imaging and tissue analysis, with doctors selecting the best approach, whether it's a bronchoscopy, a needle biopsy, or surgical exploration, based on the tumor's location and the patient's overall health. Today, lung cancer treatment options have become more sophisticated and senior-friendly. When the cancer is caught early, surgery is often the first choice, and thanks to modern techniques, many procedures are now minimally invasive, making recovery much easier for older patients. Stereotactic body radiation therapy, or SBRT, offers a powerful, non-surgical option with precision targeting. For those with more advanced disease, targeted therapies and immunotherapy have emerged as effective and better tolerated alternatives to traditional chemotherapy. And perhaps most importantly, for older adults, treatment plans now place greater emphasis on maintaining quality of life, not just prolonging it. 7. Bladder cancer. Bladder cancer represents one of the most significant cancer concerns for elderly populations, particularly men. More than 70% of all bladder cancer cases affect men between ages 50 and 80. This striking statistic highlights the importance of bladder health awareness as we age. The bladder, a hollow organ in the lower abdomen that stores urine, becomes increasingly vulnerable to cancer-causing agents over time. Years of exposure to carcinogens that are filtered through the kidneys and concentrated in the bladder can damage the organ's protective lining. This accumulated damage explains why bladder cancer is predominantly a disease of older adults. Recognizing the warning signs of bladder cancer is crucial for early detection. The most common symptoms include frequent urination and burning sensations during urination. Blood in the urine, even if intermittent or painless, should never be ignored as it's a classic bladder cancer warning sign. Other potential symptoms that elderly individuals and their caregivers should watch for include pelvic pain and a distended bladder. Some patients may experience urinary urgency or feel the need to urinate but produce little output. These symptoms can significantly impact quality of life and should prompt a medical evaluation. Risk factors for bladder cancer extend beyond age and gender. Smoking remains the single greatest risk factor, responsible for approximately half of all cases. The chemicals in tobacco smoke enter the bloodstream, are filtered by the kidneys, and ultimately come in contact with the bladder lining, causing damage over time. Chronic bladder inflammation, whether from recurrent urinary tract infections or long-term catheter use, may also increase bladder cancer risk in elderly individuals. Parasitic infections, though rare in developed countries, contribute to bladder cancer rates globally. Certain medications, such as the diabetes drug pioglitazone and chemotherapy medications like cyclophosphamide, have also been linked to increased risk. Diagnosis of bladder cancer typically begins with urinalysis to check for blood and other abnormalities. Cystoscopy, a procedure that allows doctors to examine the bladder lining directly, serves as the gold standard for diagnosis. During this procedure, suspicious areas can be biopsied to confirm cancer presence. Treatment approaches for elderly bladder cancer patients vary based on the disease stage and the patient's overall health. For non-muscle invasive cancers, transurethral resection followed by intravesical therapy often proves effective. More advanced cases may require radical cystectomy, bladder removal, or combinations of chemotherapy and radiation. Before we wrap up, remember this: growing older doesn't mean losing control of your health. By staying informed, recognizing the warning signs early, and understanding your options, you can face the future with strength and confidence. Your health is your greatest asset. Protect it with knowledge, vigilance, and action. If you found this video helpful, don't forget to give it a thumbs up, share it with someone you care about, and most importantly, subscribe to our channel. We're here to bring you powerful health insights designed especially for seniors, every single week. Until next time, stay healthy, stay aware, and take good care of yourself.